Hi, I'm Brian.
I'm Alden.
We're both physician assistants here at Attune Health. We just wanted to reach out and let you guys know what we're all about here. I know a lot of you have been able to interact with all of us, or both of us at one point or another already, but I think there's still a lot of questions as to what our role is and what our backgrounds are. So we just wanted to give you a little bit of information behind what we're trying to do here.
So a PA, or physician assistant, also known as physician associate, is an advanced practice provider. So we're qualified medical professionals, clinicians, providers, whatever word you want to use. We are qualified to diagnose, treat, and we go through 2 to 3 years of medical schooling. So that includes basic sciences, rotations with hospitals and clinics, and we're under the supervision of supervising doctors. So, that's essentially what a PA is. A PA is similar to an NP in many ways. We're both licensed and credentialed in the state of California to practice medicine. One distinction is that, again, PAs are under the supervision of a medical doctor. So we work closely with the medical team to help carry out treatment plans, communicate with you about lab results and imaging, and help extend the reach of the physicians. Brian, is there anything else you'd like to add?
No, Alden, I think you did a really good job elaborating on that, but I would say there are a few other small differences between the different practices. So specifically between doctors, so DOs and MDs, nurse practitioners and physician associates or assistants like myself and Alden, really the big changes between these different areas are we can't necessarily practice medicine on our own. So we are contingent on the supervising physician to give us a little bit more guidance, but we're able to do things like prescribe medications, as Alden mentioned, and do these things independently, but we do work with them closely in terms of supervising physicians. In terms of nurse practitioners, on the other hand, they're a little bit different in the model and their training habits. The idea is Alden and I both were trained in the medical model, which means that we work with differentials and we understand the medicine behind that in the sense of scientific backgrounds, and we try to eliminate differential diagnoses through imaging, labs, and our clinical diagnosis of the situation. Nurse practitioners are more based in the nursing model, which they are nurses by trade. So they are fantastic in providing those primary care settings especially, but they're really based in the nursing model. So really there's different approaches to the same problem, and both have their strengths and weaknesses. But in terms of how we're trained, we're definitely based more in the medical model versus a nurse practitioner. In terms of the MD model, as Alden mentioned too, the training that's required of MDs and DOs really requires residencies post graduation. In our case, we don't require the residency, but our training is a lot of on-the-job situations with people like Dr. Scaramingis and Dr. Ventropoli in our case. So we work closely with them. We work closely with them so that we can kind of fine-tune your diagnoses and your therapies moving forward. So rheumatology is a really interesting subspecialty of internal medicine. It's provided for me a lot of intellectual stimulation, but I also have the ability to do procedures, which I absolutely love too. The sense that I can basically look at things more critically and analyze things from a really cognitive standpoint and try to analyze the situation and be able to do these procedures that help people quickly, I really do enjoy that component of it. But rheumatology in general is a really complex and really interesting subspecialty, and I think that's what drives me really into this, is the idea that there's always something more to learn, there's something more to grow with, there's something more to try to develop into those in terms of your skill sets. So I really do think that this is a growing field that actually allows PAs like Alden and I to really hone our craft, but really kind of differentiate ourselves as well.
Yeah, and I guess to add to that, as a subspecialty of internal medicine, of course, rheumatology has a lot of overlap with things that are affecting you in your everyday life outside of your rheumatologic diagnosis. So I think, taking into consideration the other chronic conditions that you might be experiencing, different lifestyle factors that might be contributing to whatever disease process is going on with you, I think it allows the opportunity for, especially for physician assistants, to work closely with patients in education and carrying forward lifestyle modifications and treatment plans, and stay connected and continue the care outside the boundaries of the clinic. So I think it's a PAs and nurse practitioners are used in different ways and across different specialties, but I think at Attune Health, for me, it seems like a good balance between, like Brian was saying, being able to do some of these treatment plans for osteoporosis, osteoarthritis, gout, some conditions that we can kind of take care of on our own, and then of course there are conditions that are very high, of high complexity and are primarily championed by the physician, but we can kind of fill the gaps there. So, yeah.
I think here at Attune Health, we really have a different approach, and really our focus here is on a team-based approach. Alden and I, again, being physician assistants / associates, we work closely with Dr. Skiramingas and Dr. Ventrapalli to basically make sure the patients get taken care of. So everything that comes through that door, the thought process is we handle all this in a team-based approach, and that's really how we've been trained to. So I hope when you're coming into the clinic, you understand that all of this is essential to your care. All of us are working together, and you're not really being seen by just one provider. You're being seen by a team. This is all a team approach, and honestly, that seems to yield the best benefits for us in most cases.
Thanks everyone for listening, and I guess see you here in the clinic.
Look forward to it.